dress, undress, cook, do the laundry, clean.
That was just part of the routine for Leticia Panama Rivas, working as a home health aide 24 hours a day, sometimes 5 days a week. The work continued straight through the night.
I have to check every 2 hours because he used to pee a lot. So I have to empty out the bottle and check that he's breathing.
The reward for all that effort, only being paid 13 of those 24 hours worked. And as unfair as that may seem, it's all completely legal in New York. Here's why. Home health aides are reimbursed by the state, which gets money under Medicaid from the federal government. New York State assumes home health workers have time to sleep, eat, and take breaks, deserving 13 hours pay, usually at around 18 an hour. Other aides, like Genesis Ruiz, told us those expectations are ridiculous based on routine patient needs.
She usually asks for help like 3 or 4 times a night, in the middle of the night. So there is no way I can sleep.
The idea that we have workers in our city who are basically getting poverty wages, who are almost exclusively women of color, it seems that it's not a New York I believe in.
State Assembly member Harvey Epstein is trying to pass legislation to bring some relief to the more than 230,000 home health aide workers across the state.
If we said that to a firefighter, we know you have to work 24-hour shifts, but we're only going to pay you for 13, we would never hear of it. It wouldn't happen.
His legislation would require 24-hour days be divided among 2 workers doing 12-hour shifts. It would also cap the number of hours worked in a given week at 50.
The reality is you don't want someone providing health care to you who've been up for hours and hours.
The cost of such a plan would be steep, roughly $1 billion hit to the state budget.
We're fired up! Can't take no more!
But overworked and underpaid healthcare workers is an even broader concern statewide. We found nurses as far away as Albany on strike, facing benefit cuts and mandatory long hours.
There's days I work 17-hour shifts, 16-hour shifts, 15. I'm doing doubles this weekend to make sure I'm here to take care of my residents. They are the main focus here.
And many, like Joanne St. John, were right there on the picket lines with their caretakers.
That's not right. They shouldn't be doing that, but they do it because they care.
Separate legislation is being considered to cap nursing home hours as well. Rivas wishes protections had been there for her. She now uses a walker to get around after getting badly injured from lifting and moving a patient in the midst of working back-to-back-to-back 24-hour shifts. Now this home health aide, once paid with Medicaid dollars, is herself in need of government assistance.
Look, I got injured. So in a way or another, it would say the agency and the system.
Something else to consider with these 24-hour shifts is the human and the economic toll. These home health aides rarely see their families and don't really have an opportunity or the time to get continuing education to make their lives better. Henry Rossoff, PIX 11 News.